What is blood poisoning sepsis? Blood poisoning, medically known as sepsis, is a life-threatening condition that occurs when the body's response to an infection causes widespread inflammation and organ dysfunction. Sepsis is not a specific infection itself, but a complication that arises when the immune system's reaction to an infection spirals out of control, leading to damage to the body's own tissues and organs. Causes of sepsis. Sepsis can be triggered by any infection, but common sources include 1. Bacterial infections. Most frequently caused by bacterial infections in the lungs, urinary tract, abdomen, or bloodstream, bacteremia. 2. Other pathogens. Fungi, viruses, and parasites can also cause sepsis, although less commonly. 3. Common infection sites. Lungs, pneumonia, urinary tract, kidney or bladder infections. Abdomen, peritonitis or bowel perforation. Skin, cellulitis or infected wounds. Risk factors for sepsis. 1. Weakened immune system. People with chronic illnesses, e.g., diabetes, HIV/AIDS, cancer. Individuals undergoing chemotherapy or organ transplants. 2. Hospitalization. Infections acquired in hospitals, especially in intensive care units, ICUs. 3. Age. Very young infants and older adults are at higher risk. 4. Invasive devices. Catheters, breathing tubes, or central lines can introduce bacteria into the body. 5. Severe injuries or burns. Increased susceptibility to infections. Symptoms of sepsis. Sepsis symptoms can develop quickly and vary in severity. Early detection is critical. Early signs: fever or hypothermia, low body temperature, chills and shivering, rapid heart rate, tachycardia, fast breathing, tachypnea, confusion or disorientation. Advanced symptoms: severe sepsis, difficulty breathing, drop in urine output, low blood pressure, cool, clammy or pale skin, extreme fatigue or weakness. Septic shock, a severe and advanced stage of sepsis characterized by persistently low blood pressure despite fluid resuscitation. Organ failure, e.g., kidney, liver, lungs. High risk of death. Diagnosis of sepsis. Sepsis is diagnosed through a combination of clinical evaluation and laboratory tests. 1. Clinical criteria. Elevated heart rate, greater than 90 beats/min. Rapid breathing, greater than 20 breaths/min. Abnormal body temperature, high or low. Altered mental state. 2. Laboratory tests. Blood tests. Detect infection, e.g., white blood cell count, blood cultures. Identify organ dysfunction, e.g., elevated lactate, abnormal kidney or liver function. Urine tests. Check for urinary tract infections. Imaging tests. X-rays, CT scans, or ultrasounds to locate the source of infection. 3. SOFA or QSOFA scores. Tools used to assess the severity of sepsis and predict outcomes. Treatment of sepsis. Sepsis requires immediate medical intervention, typically in a hospital setting and often in an intensive care unit, ICU. 1. Antibiotics. Broad-spectrum antibiotics are administered as soon as possible to target the infection. Once the specific pathogen is identified, antibiotics may be adjusted. 2. Fluid resuscitation. Intravenous. 4. Fluids help restore blood pressure and improve organ perfusion. 3. Vasoactive medications. Drugs like norepinephrine may be used if, for fluids alone, do not stabilize blood pressure. 4. Oxygen therapy and mechanical ventilation. For patients with breathing difficulties or lung involvement. 5. Treatment of the underlying infection. Draining abscesses or removing infected devices if necessary. 6. Supportive care. Dialysis for kidney failure. Blood transfusions for clotting abnormalities. Complications of sepsis. If untreated or inadequately managed, sepsis can lead to 1. Septic shock. Severe drop in blood pressure causing multiple organ failure. 2. Organ dysfunction. Kidneys, lungs, liver, or heart may fail. 3. Disseminated intravascular coagulation, DIC. abnormal clotting and bleeding throughout the body. 4. Long-term effects. Many survivors experience lingering problems such as fatigue, cognitive difficulties, and organ damage. Prevention of sepsis. 1. Infection control. Vaccination against infections like pneumonia, influenza, and meningitis. Proper wound care and hygiene. 2. Prompt treatment. Early treatment of infections to prevent progression to sepsis. 3. Hospital infection protocols. Hand hygiene and sterile techniques in healthcare settings. Prognosis. The outcome of sepsis depends on its severity, the patient's overall health, and the speed of diagnosis and treatment. While mild cases can resolve with proper care, severe sepsis and septic shock carry a high risk of mortality. Early recognition and treatment significantly improve the chances of survival.